Our next speaker is Dr. Dilip Sarkar, the Executive Director at the School of Integrative Medicine at Taksha University, will be speaking on yoga for hypertension and cardiac problems. He will explain the mechanism of the action of yoga therapy and will demonstrate how yoga can be practiced by anyone in any condition with regularity, commitment, and perseverance. One can reverse any disease, including heart disease.
Good morning. Before I start, this is my email address, this is my cell phone. Only thing I do these days is I teach yoga therapy, primarily to the medical people, physicians, and I do a CME program. So if you have any question, any concern about any patient, please call me, write to me. That's the only thing I do. I'm hooked up on my cell phone or hooked up on my computer. First, the yoga therapy per se, for any disease, is a daily practice. A daily practice for rest and relaxation of the organ concerned. And it is a holistic practice. Holistic practice means we use all the modalities of yoga to achieve that rest and relaxation. As for example, we use a philosophy, Yoga Sutra of Patanjali. We use all different yogas, Karma Yoga, Bhakti Yoga, what we have heard. We use 8 limbs of yoga, Yam, Niyam, Asana, Pranayama, Pratyahara, Dhyan, Dharan, Samadhi. It is not a reductionist approach. It is not like that I take a Tylenol for my headache. We are going to reach the rest and relaxation with all the different paths. So everybody asks me, give me the asanas, pranayams, meditation for what is for hypertension, what is for heart disease. My answer to that is that I'm going to give you a concept. You are going to be a teacher. You're going to teach your patient. Going to give you a concept, then with your mind, you are going to formulate and you are going to help those patients. All the physician comes to me. I do a CME program. Last year I was doing a program with 40 physicians. Ask me, how can I use it in my practice? Answer is very simple. Why don't you do it? Feel it yourself first. I'm here as a bright example. I had open heart surgery 11 years back. I don't take any medication, nothing, but I do a daily practice of yoga. So let's see, we are going to give you all the evidence-based. All the physicians ask me to give me the evidence-based medicine. We have been evidencing. Nagarathan had published a paper on bronchial asthma, published in British Medical Journal in 1985. I will show you the data, hypertension data in Lancet in 1973. We have been publishing it for so long, now it became a practice-based evidence. What is practice-based evidence? A difference in the research. The research protocol in Western medicine, conventional medicine is, I do a research, I have a data, Ashwini does the same thing, she has the data, Matra will be the same thing, she will have a data, reproducible data, we use it in our research, in our clinical trial, then use it in our work. But yoga, on the other hand, is a practice-based evidence. We've been practicing it for 5,000, 6,000, I don't know. My new carbon data says we're doing it for 10,000 years. So there is no question about it, and I will show you. So where it started, what the data are. But again, it is all experiential. But as we said, for the Western mind, we have to do some research. That's what we have the organization. International Association of Yoga Therapists. Our executive director is sitting here, John Kepner, 3,000 member. We'll show you. We have the journals. This is one I just published a little while ago to give you a little idea for the people to understand. This is called Understanding Yoga Therapy Research. But I'm not going to go over all this stuff. I'm going to give you a little bit of an idea what to do for a patient who has hypertension and a cardiac disease. So First of all, how all this thing evolved? This thing evolved because by practicing yoga, we have known one thing called voluntary control over involuntary function. We used to think that autonomic nervous system is autonomic, but we know now that it is not autonomic anymore. You see the yogis, they can hold their breath, they can be under the ground for months or hours, God knows how long. They can walk on a nail, walk on the fire. So this is the first Western evidence of Swami Rama. You have the Himalayan Institute, 1969. He first voluntarily stopped his heart in front of a physician. It was Dr. Elmer Green. But when he did EKG, we find it was an atrial fibrillation. It was not a total cardiac stop, it was atrial fibrillation. But what he did at the time, our hand has the two arteries, radial artery and ulnar artery. He could selectively shut down one of the arteries for the blood flow. This is the way it came that we need some research work and need to see that yoga has some role in hypertension and heart disease. Now, as I said, the evidence-based, we look at PubMed as a physician. PubMed Central, and we do all the online search. But I don't know what is all of your background, but any place I go, only thing they said, I have a guru. I said, who is your guru? My guru is called Google. My Google is my guru. So what is here, I just want to even show you, this is a Google search. Google has a product called a Google Scholar. I don't know if you know it, but Google Scholar is better than any other online research journal search. It's an amazing, amazing product called a Google Scholar. If you type in Google Scholar, you go back to first, look at that where you went to. In 1973, the first article came up on yoga and biofeedback for the management of hypertension. This was published in Lancet, one of the most prestigious journals you can even think about. So there are 20 patients, the medication was stopped in 5 patients, reduced in 7 patients, 4 patients did not have any response. They were so fascinated, they went ahead and did a randomized controlled trial published in 1975. So that's what I'm saying. When I talk to the physician, I tell them, what more evidence you need? This is probably before many of the physicians are born who have been practicing medicine. You can see there are 36 patients that randomized for 6 weeks, treated group, blood pressure dropped from 168 to 141, there's a number, control group have this. I'm going to go over with a lot of slides now because I just want to give you a little bit of a flavor of what yoga is for hypertension and heart disease. This is for a cardiac disease. If you do the same, that Google Scholar, you will see the date back to 1985 or 1995, and most of the papers. Look at the journals are talking about Lancet, JAMA, in intensive lifestyle changes, and it's all from Dean Ornish. If you see that Dean Ornish has first shown that it is reversible. And Dean Ornish is a program. He's just next door. He's in UCSF, and this is his program. His program is called Ornish Spectrum Program. This is for reversing of the cardiac disease through lifestyle. But if you know the story of Dean Ornish, anybody knows where he comes from, he was trained by Satchitanand. And he even claims himself, you know what he claims? He had ADD. He could not even function. His sister was a follower of Satchitanand. And he became a Satchitanand's follower. He went to Harvard Medical School, became a professor of cardiology in UCSF. He's been doing it for the last 35 years. And today, this is approved by Medicare. You know, our system is called a healthcare system. But what do? We do a disease care. 99.9% with disease care. Obama talks about healthcare. I said, to Obama, healthcare is free. Healthcare is yours. This is the health, and Medicare is now approving this health. Look at this program, fascinating program he's doing. He has shown first, published the article, that the reversal of heart disease to the point he has shown even the angiogram. There is a blockage in the coronary arteries, blood going to the heart, it even opens up. There is some angiographic evidence, blockage which opens up with his program. This is a famous, I don't think you can read too much. What worries me is that we are all becoming alternative medicine. And it is all going to happen more and more. So this is what it is. We talk about what is yoga therapy. Yoga therapy is rest and relaxation to the organ. And this is the person who first noticed it, Herbert Benson. He was a follower of Maharishi Mahesh Yogi. He showed that relaxation reduces heart rate, blood pressure. He went ahead and published and wrote this book called Relaxation Response. And it became an instant hit for the medical community. So what is the blood pressure? Blood pressure is a product of a cardiac output into called peripheral resistance. Cardiac output means amount of blood which heart can pump, peripheral resistance and tightening of the blood vessels. So the moment you relax these blood vessels, peripheral resistance drops down, blood pressure drops down. What happened? A cardiac output is a product of the heart rate times stroke volume. The heart rate is the amount of time heart will beat. Stroke volume is the amount of blood a heart can contract and pump. So the moment you reduce the heart rate, cardiac output comes down, blood pressure drops. Very simple equation, understandable every physician who went to medical school. So basically what we say, that when you practice and patient comes in, all the patients are called rogi. Rogi means they have a disease. They are not going to do yoga. We put them in the chair, we get their spine straight, eyes closed, do some little very gentle pranayama, breathing out longer than breathing in, and we'll show you what to do. Then we convert them called nirogi, mean no disease. Then they become yogi. When they become yogi, they start doing yoga. So these are the way we first start with the patient who comes with a very severe hypertensive and a heart disease. We do it in a cardiac rehab. The people who just have an open heart surgery, we do the people with the in my center. First, we let them in grounding poses. We will sit them in a chair. They sit in a chair in the front. They slide all the way to the back and keep the spine straight. Keep the spine straight, eyes closed. We call it manasthir, yogic breathing. We just let them do it, breathing out longer than breathing in. Lung is like a balloon, and do completely effortless. We do not do any pranayama like yogis. We do all the pranayama like a absolutely effortless, and slowly they became from rogi to nirogi. We do a tremendous amount of Om chanting because we believe at the research work today, the frequency of the Om almost has the same calming, cooling frequency of the brain, and this is called a harmonic resonance. Two frequency interacts and cancels those frequencies, sustain a calm and a cool state. And then we put down in a stages of asanas. When you put a person in asanas, with the muscle contracts, initially it's called arambha, beginning. Then the muscle starts to relax. It's called a sthiti, stability, and a visarjan. We go to different phases, and here is it that to show the inhalation is sympathetic, exhalation is parasympathetic. So again, we are going to do one thing, that by the time we keep them in this position for a longer time, brain gets a signal called neuroplasticity. Brain thinks that's how I need to be. So what happens slowly and slowly, that impact goes to the smooth muscles, the blood vessels starts to relax, the better perfusion of the coronary arteries, and I will show you what happens. The plaque starts to get regress. So what happens here, when the blood vessel, the coronary arteries, the blood going to the heart, when they are in a state of spasm, in the tightness, there is a lining inside called endothelium. Endothelium breaks down. Endothelial health goes down. We are alive, we are functional because of only almost one thing. It's called endothelial function. So when the endothelium breaks down, all the calcium, cholesterol, everything deposits and forms like a plaque. Then got a blockage in the artery. It doesn't have to be blocked. They get a sudden emotional changes, sudden physical change in the blood pressure, heart rate, the plaque breaks down. It's called an unstable plaque and gets an acute heart attack. But if the blood vessel is relaxed, the endothelium is functioning, all the things goes through there, all the cholesterol, calcium goes there, doesn't get deposited. In fact, it starts to regress slowly and slowly in that factor. Let me go quickly to let you know how we do it. And the most important thing we believe today, that what Nagaratna was saying, the root cause of hypertension and heart, all the disease is a monomaya kosha, is the mind. It is called a brain arousal. And we know very much about brain arousal in Western terms, is that people with the sleep apnea and insomnia, has the highest incidence of now has a coronary disease and hypertension. This is a significant, the results now, and this John Hopkins is a paper, but this is a beautiful story I heard from Sri Sri Ravi Shankar. I don't know if all of you should know Sri Sri Ravi Shankar now. So Ravi Shankar said a story, a man who had a heart disease won $1 million in the lottery. His wife found it out, and wife was afraid to tell him because he thought he might get another heart attack. So his wife went to the usual thing what you do in America. The wife went to the church, and talked to the father, talked to the priest. So, Father, can you help me break the news to my husband so he doesn't get a heart attack? Father said, yes, why don't you bring him? We'll do a little praying. So he brought him, we did a little praying, the whole hands. The father brought the news. What you will do if you get $1 million in the lottery? The man looks at the father, said, Father, if I get $1 million in the lottery, I'll give your church and you $100,000. And guess what happened? Any guess? Priest got a heart attack, So the priest got a heart attack. So that is the story of brain arousal, So it's a very, very important story. The priest got a heart attack, okay? So now, how does this work? It works this way. Our body has a defense mechanism called hypothalamic function, called negative feedback cycle. If we get an arousal here, if arousal activity, body will recover it. That is called our body's healing power. In fact, what yoga does, Ayurveda does, everything. We tap our healing power of the body. And very interesting, what the physicians will do? We don't get the healing power to work. So what happened? Number 1 cause of death in this country is cardiovascular disease. Number 2 cause of disease is cancer. Number 3rd cause of disease. Any guess? Accidents. Stroke. Called iatrogenic. The doctors induce death. It is a complication of the procedures and the drugs. 100,000 people die from the complication of the medication and the drugs. There's a fantastic joke. In Canada, the doctors went to strike. Canada is a national health care. The doctors went to strike, and you know what happened when the doctors went to strike? The hospital death rate came down. So, this is what happens in our daily life. You get one arousal response. Before it comes down to normal, you get another arousal response. These are called stroke. So it goes up. Before that, it's called maladaptive response. And here it is, what we call idiopathic hypertension. We don't know what is the cause of this hypertension. We as a yogi, we know what is the cause of this hypertension. So that's the way it looks like today, that what is called a white coat hypertension. Brain arousal. You go to see a doctor, but when the doctor sits down like this, there is no more white coat hypertension. The doctor sits down in lotus position, and this is the connection, the brain and heart connection, because you know the word we use. What do you use? Memorized by heart. Our soul is here. The heart is totally dependent on the manomaya kosha. This is the disease of the manomaya kosha. And how it is all connected? When you had an emotion, the emotion connects into the area called a limbic system. The 2 nuclei called amygdala and hippocampus. Amygdala and hippocampus sends a signal to your hypothalamus through neurotransmitter. It's called a neuro area. That sends a signal to the pituitary gland. Pituitary gland sends a signal to the adrenal gland. That's called a psychoneuroendocrinology. That is the pathway of that. And most important thing for you to take home today. This is called our body, mind, and spirit. In a computer science, we say our body is the hardware, mind is the software, spirit is the programmer. And who is the programmer? I am the programmer. I fix my software, hardware is all fixed. Doesn't matter what you do. You put the angioplasty stent, do all the medication, everything is not going to work unless you fix what Dr. Nagaratan was saying. If you don't fix your software, the mind, nothing is going to be fixed. I'm going to be very quick now. I'm going to show you some slides. These are all the koshas you have already seen, but the disease is in the monomaya kosha. And essentially, it is a deep internal awareness and reduction. And all the patient will say, with stages, with faith, impossible become possible. Okay? And let me just go ahead. I know you'll have some questions. I just have only 19 minutes. I spoke. So about 10 more minutes. I'll spend about 5 more minutes. So 5 more minutes of question. Are you question now or later on? Now? Oh, okay. So let me just go 4 or 5 more minutes, okay? I'll finish in half an hour. Okay, thank you. I've been doing it. I'm a vagabond, That's the only thing I do. I talk, Sometimes when I talk for 6 hours, So again, these are the things, which you can do. But one very important thing for hypertension and heart disease. How many of you know what is netipat? Jalneti. Netipat. All of you should do netipat. Netipat does one thing, very important thing. When you do a netipat, when you put the water in your nose, comes out, nose gets clean. But it burns, what happens? Your eye starts burning, everything is burning, it makes your life miserable. But you keep on doing it. What happened? It doesn't burn anymore. You don't need that saline water anymore. You can do normal water. What happened? Your irritation goes away. Now nobody bothers you anymore. Your mother-in-law doesn't bother you anymore. Your daughter doesn't bother you anymore. Your boss doesn't bother you anymore. So what happened? The blood pressure doesn't go up anymore. Blood pressure is the reason for irritation. Jalneti is a powerful tool to controlling your blood pressure and coronary disease. Please do, everybody. I've been doing it for years and years. Another very important thing is called heart rate variability. We talked about. These are going a little bit more in depth and details, which will show when people comes from here. These are called baroreceptor sensitivity. This is one very important thing. I just want to let you just talk to you for a minute before I finish. Is that if you do a person headstand, we talked about yesterday in our yoga space. This fellow cannot do a headstand. So somebody is holding him up. So what happened? All the pressure inside the head is high, pressure inside the brain is high, his blood pressure goes up, heart rate goes up, he looks miserable. But if we can get up into a headstand, and you will see what happened. This is 2 of my physicians, they are actually pulmonary physician. They have one tool in their hand called a Doppler. And that is the only thing they use. And what I tell them very simply, they're using Doppler all the time. Like if your only tool is a hammer, whole world is a nail. So they've been doing a Doppler every time. So what happens if the person can stay up in a headstand, and then you do the carotid flow, in the blood flow in the neck, it is normal. Even if you go to intracranial, this is called a transcranial Doppler. Intracranial Doppler, when you do blood flow, there's a little high diastolic flow, but they're all normal. What does it mean? That body has the defense mechanism. You keep your head down, slowly baroreceptors get sensitive, your pressure, intracranial pressure goes down. So if body can lower my heart rate, lower my pressure, it'll be able to do it for hypertension and heart disease. That's what we recommend. Very slow, a lot of controversy. I said, you know what, your defense mechanism is body feedback. Put your head down, you listen to your breath. Annamaya kosha to pranomaya kosha. Anything you do to this annamaya kosha, it will reflect in pranomaya kosha. If a breath is completely effortless, if you have no pain, if you have stability, sthiti, keep on going. In stages, impossible become possible. And that is showing that in the leg pressure is there too. I'm going to have a couple of minutes for question and answer, just to show you, that's showing that even the renal artery gets improved. And these are all the publications, and these are also genetics. People talk about genetics. Genetics has nothing to do with your health. It's called epigenetics, how you handle your genetics. Yoga is like a switch. It turns on and turns off your genes. This is called, you will see, your Y DNA is not your destiny. So this is the way it works. You have a genetic predisposition for the hypertension or heart disease. You did something in the lifestyle, you get a genetic expression as a clinical disease, and then if you use yoga therapy, you call genetic suppression. When you genetic suppression, you prevent the progression and the progression of the disease. It's a very, very important concept. Couple minutes, I just want to show you how it works. Primary prevention. My father has a hypertension. If I continue yoga therapy, I don't have any hypertension. Secondary prevention, like me, I have a genetic predisposition, I have a heart disease, I have a yoga therapy, genetic suppression, I prevent the progression and reversal of the disease. But this is the most important thing, that when you continue yoga therapy, better management of the disease, less pharmaceutical support, better quality of life. I am like a Energizer battery. I wake up 5 o'clock in the morning. It doesn't matter. I don't sleep. I don't take any medication. I eat very little. I can go long years and years without any medication, without any food. These are the things just for the people who wants to know what to do. We use a lot of Chandra Namaskar instead of Surya Namaskar. We know Chandra Namaskar is a cooling. We do a lot of Chandra Vedi Pranayama. And these are all the asanas. This is a paper presented, published in Journal of Alternative Complementary Medicine. This was actually from a big study from Swami Ramdev's group, showing that all the changes it happens, and these are the things we are doing in our hospital. This is like I talk to all the physicians. Only thing I do, I'm in a position now, all the physicians listens to me, is a grand round called CME. I do all the CME. This is my hospital, continuing medical education grand rounds. The topics, what is the topic here? It's on a wellness, basically yoga therapy for cardiac wellness. We do it, all these things we are doing it now, and I'm going to stop it. Let me see how many more slides I have here. That's the biggest thing. How many physicians are here? Doctors? 1, 2, 3, 4, 5. You have a prescription printed by your drug companies? Ask them to print a prescription like that, That'll work, no? Yoga therapy for coronary artery disease. And this is what you get. I get the email from the physicians and from the patients. And again, the medications they give. This is the thing I tell the physicians. To progress coronary artery disease, they give an aspirin, statin, beta blocker, ACE inhibitor. And we can show how the yogic process you can get rid of all the medications. And this is the slide I use all the time in my presentation. And I told you yesterday that this is the famous slide from Satchidanand. Satchidanand is in a Yogaville. He'd been invited to University of Virginia, 500 physicians, to talk about medical benefits of yoga. He got up, took a chalk, he wrote down illness and wellness. He circulated I and we. This is the end of my talk. Illness starts with I, wellness starts with you, we. Thank you for your attention. If you have any question, I'll be glad to answer. If you don't have any time, I'm here. You have my email address, my cell phone. I do answer cell phone every now and then. Okay? Any questions? And just to let you know, I'm on time, okay? This is my passion now. The only thing I do. I talk, give a talk. Any questions? The question here is for you to take home. This is like a seed inside your head. Take home. What is your thought process? Manomaya kosha, software, hardware. If you do anything in the hardware, it's not going to be fixed. You have a question? First one here.
Thank you for your presentation. I was no education, but I got little education and it was dangerous. So if I have a question, I will send you an email.
Beautiful. And I will answer it too. Promise.
So what is the treatment for macular degeneration and macular patina in yoga and Ayurveda treatment?
This is not a part of this discussion.
I'm sorry.
Sorry for the question. Next one. I'm sorry. I'm a teacher. I've been teaching all my life. We have a time short, and you have to be answered for what I presented. Next one.
Thank you for your talk.
Yes.
I have a question. In one of the slides, you mentioned that exhalation acts on the parasympathetic nervous system.
Yes.
Can you talk a little bit more?
It is a lot of go to PubMed, okay, and type Shirley Tellis. Type Shirley Tellis. You know who Shirley Tellis is? Go to the PubMed, Shirley. There is a volume research. What you could do if you do a deep inhalation. It's a negative pressure, negative intrathoracic pressure, and it reduces our heart. There's a lot of physiological mechanism, but just take it in mind that remember this: inhalation is sympathetic, and exhalation is parasympathetic. There's a lot of data, a lot of paper, a lot of physiology there, a lot of information is there. To explaining here, it will take about half an hour. But just remember, when you practice, the way we practice that pranayama, count of 3 in, 1 and 2 and a 3 in, count of 6 out. 1 and 2 and the 3 and the 4 and the 5 and the 6 out. And slowly they progress, completely effortless, as if, like the way they breathe in, when they breathe out, we do not do the yogic breathing, we just do. Then it progress. Yeah, this is enough data to show. Any other question? Anybody? Yes, ma'am.
You said body is hardware, mind is software, and
Spirit is a programmer, and the programmer is nobody but I. Look at the words we use. I have diabetes. Mind doesn't have a diabetes. My body has a diabetes, but I have diabetes. So who is I? I am the programmer. I am the Anandamaya Kosha. I am controlling the Vijnanamaya. Remember one thing, at the Anandamaya Kosha, I am in balance, I am disease free. So at Vijnanamaya Kosha, I start having some imbalances. My body will have imbalances, but Vijnan, what is rationality? It pulls you down. Don't do it. But in the Monomaya Kosha, I start all the imbalances and have no control. So the Monomaya Kosha gets imbalanced, it shows up in a Pranomaya Kosha. So you see that people who have a disease are sitting there, I can tell you how many of all of you have a disease. If you look the way you are breathing now. But then Pranomaya Kosha gets imbalanced, it gets into Annamaya Kosha. Annamaya Kosha is the body. By the time you have a diabetes or a hypertension or heart disease, you are already too late. That's what in Ayurveda, what we have 6 stages of disease. The first 3 stages are called whispering. Last 3 stages are called shouting. So we have to pick up the disease in the whispering state. That's what she was all talking about. All the extensive research in Vyasa showed. So all in here in Manomaya Kosha. Anything else? I don't want to get over the next person's time. I'm very concerned about these things. You know, when you be on the time, because when you extend your time, you get into next person's time. There's a red flag here. Thank you for your attention. I'm here. Please find it. Thank you.